When patients come to my office, they often bring lists of supplements and medication they're taking, and I'm often surprised by how long those lists are. Among them, I find supplements that are unnecessary or shouldn't be taken for long term. I thought it would be a good idea to share which ones you can take for the long term and which ones you shouldn't take for more than 3 months. Have you ever wondered what the ideal duration is for taking supplements and whether you should take a breaks in between? Most supplements are okay to take for the rest of your life because they are generally safe and available without prescription. However, as study progresses on certain ingredients, we discover unexpected side effects. While these ingredients may not pose much harm in the short term, prolonged use or high dosage could lead to more serious problems than benefits. The supplements I'll be sharing today are quite popular, so please pay close attention, especially if you're taking multivitamins or several supplements. You ready? Let's go! First up is choline. Every year, I attend the Natural Product Expo to keep up with the latest trend in the supplements. Last year, I noticed the significant focus on brain-related supplements, and choline was one of the key ingredients. Choline is an essential nutrient for acetylcholine, which function as a neurotransmitter, playing a role in brain function and cardiovascular health. However, scientists discovered an unexpected problem. Choline can produce compound called TMAO, and this TMAO is a metabolite produced by gut bacteria from excess choline in intestine. Elevated TMAO levels are associated with high risk of heart problems, particularly if you're on a diet high in choline, which showed a 20% higher mortality rate. While it's not yet confirmed whether choline supplements directly cause the cardiovascular risk, but there appear to be a correlation. When it comes to the health decision, it's best to err on the side of caution. In other words, there is no real need to take choline supplements, given the potential risk. However, not all forms of choline pose the same problem. The issues are absorption and dosage. So, avoid choline bitartrate or choline chloride, which have low absorption rates, and stick to the dose under 400 mg. If you must take choline, try for about 3 months and then give yourself another 3 months break before taking it again. And CDP choline or phospholipid choline have higher absorption rates and generally safer. Sometimes vitamin B supplements come with the cholines, but the doses are usually lower, so no need to worry about that. Also, be cautious about the L-carnitine and betaine HCl, as they can also elevate TMAO levels through the same mechanism as choline. So just try for 3 months first and see how you feel. Next is the zinc. As I mentioned in my prostate video, zinc is indeed a beneficial supplement, not only for men's health, but also for maintaining a strong immune system and healthy skin, even helping with the acne. However, many people mistakenly believe that higher doses of zinc are more beneficial, especially for men's health. But that's not true. Zinc is a mineral that can easily cause a side effects. So if you're taking more than 50 mg per day, please stop right now. Overdosing on a zinc can lead to mild side effects such as a digestive issue like vomiting, nausea, stomach pain, and diarrhea, but could cause copper deficiency and weaken immunity. The NIH set the upper intake level for zinc at 40 mg. So why do we see so many 50 mg zinc supplement on the market? I think the reason is that many studies used 50 mg dosage and found them generally safe. But these were all short-term studies. So many experts recommend staying within 30 mg for long-term use. Since zinc is often found in multivitamins, be sure to check the supplement fact and avoid overdosing. Third one is a calcium. Calcium is an essential mineral for maintaining strong bone, teeth, and cardiovascular health. And this calcium has almost zero problems when you get it from the food. But supplements can be problematic. The recommended calcium dosage is around 1000 milligrams. But before I proceed, if you are taking a high dosage because your doctor prescribed it, obviously you need to keep taking it because certain medicine or certain health conditions need that extra calcium. But if you're taking without consulting your doctor, I recommend reducing to maximum of 500 milligrams. Calcium supplements are absorbed very quickly by the body, which can lead to cardiovascular issue or vascular calcification. It's best to supplement calcium through food source and minimize the supplement intake. Even then, be cautious with minimizing intake. The only exception is for severe PMS, where dose of 500 milligram to 1000 milligram may be beneficial. But even then, limit usage to 3 to 6 months. Remember, food sources are the best way to get your calcium. Next is the vitamin D. Vitamin D toxicity is really rare from sun exposure or diet. Most of the time, it happens due to the high dosage of vitamin D supplement. There is some debate about the normal range of blood level for vitamin D, but generally it's between 20 to 40 with a maximum of 50. I was once told either school or seminar that by taking 4000 IU for long term, blood level maintains in the 50s. But I couldn't find the reference for this statement, so instead I was able to find this study. According to this study, 3200 to 4000 IU carries a risk of hypercalcemia, even though it only affects a small portion of individual. It's safer to avoid high dosage of vitamin D altogether. Overdosing of vitamin D can lead to nausea, vomiting, weaknesses, and elevated blood calcium levels. Generally, even if you spend most of your time indoors and don't consume enough vitamin D rich food like fish, 1000 IU is sufficient to maintain adequate levels. So start with the 1000 IU and adjust the dosage based on your routine blood work. Lastly, it's crucial to recognize when to stop taking supplements. If you've been taking certain supplements for 3 months without seeing any targeted result, it's time to let them go. There's so little chance that continuing beyond this point will show the desired outcome. However, this doesn't apply to essential nutrients like omega-3 or vitamins, which are necessary for overall health maintenance, as many studies and medical community agrees. What I meant is for the supplements like MSM, glucosamine, or herbal supplements such as a turmeric, horny goatweed, or milk thistle, which are taken with a specific goal in mind. If you learn about certain supplement and want to give it a try, I recommend trying it for about 3 to 6 months at most. If you don't see outcomes, I would strongly recommend Eastern medicine instead because it'll be so much more effective. When I use herbal medicine for my patient, I usually use 1 or 2 rounds of herbal medicine because that's enough time to show the result, unless they're in chronic cases or hard to treat illnesses. If you're taking multivitamins, be sure to check the supplement facts as some ingredients may overlap, leading to overdosing. Hope this video was helpful, and remember, health is wealth, so invest in yourself. This is Dr. Sean, making health easy for you. See you next time.